Alright, here's Allie. And here's Allie's face. And Allie's face looks pretty good. Except she burned herself up in her nose, she tells me. A couple times. Because she likes the sun way too much.
Yeah.
So we're going to do something very simple to her today. We're going to actually do a chemical treatment on her face. A real mild one. It's not going to be someone that scares her. Allie works as an ER nurse, so her friend scared the heck out of her, said you're going to look like a monster. We're not doing anything like that today. No Monster Zero action. She probably doesn't even know what Monster Zero is because she's young, not old like yours truly. And she's wearing one of my tacky t-shirts. See? Here's my tacky t-shirt. She's cute, so I put a cute little t-shirt on her. Not that I am, because that's me. So if you were looking to fix something with any kind of a chemical treatment or any kind of facial treatment, what would you be looking to fix? What bugs?
My nose. My nose peels a lot. I don't know if there's ever a time where it doesn't peel. I always feel like I'm picking off of it.
No, don't pick your nose. It's not sexy.
If I'm looking in the mirror,
I hate those things.
up close, I don't like my pores. I think I have big pores.
I've seen what I've seen.
And then every once in a while, depending on the light, I notice
You're picking at your head. There's no stuff.
different colors. Like
yeah, you get little pigment. You get little pigment, and that's just sun exposure. That's you sitting in the sun. And what we're doing today will mitigate that somewhat, but as we talked about a little while ago, if you did something in the way of a heavier type of real peel that would actually have stuff peeling off of you, that would probably be better for you, but then you'd need some downtime. Allie's got a party Friday night, so we have to be good to her, otherwise she says, "You look what you did to me! You made me look like a monster, and now everybody's scared, including my boyfriend." Don't want to scare the boyfriend. Those guys are fickle. Alright, there you go. The way this stuff works is pretty simple. We just kind of put it on. It's kind of a little, and you won't even see the pigment change much, but you will see when I wipe a little bit. I'm going to do a little bit on your schnozzle, a little bit, not much. Here, turn the other way. There you go. You feel a little bit of tingling?
Yep.
Yeah, it just tingles a little bit. And I will stop it because your skin looks, you French, English, what's your lineage?
English, Irish, Scottish,
yeah, I can see the skin. Yeah, meaning you can't have stuff on for too long because your skin is thin. And that's why you're having these little teeny changes. And if you use TCA, you'd see this little freckling kind of fading a little bit and turning kind of white. This one won't really do that. But you will see on the end of this, you see this little tinge of stuff, and that's the gross skin cells I just removed from you. You'll never miss them. And if you do, I'm going to get you a shrink. You will be shrunk. So it's tingling a little bit more, but not really burning.
I can feel. It's a burn.
But it's a tingly burn.
Tolerable, yeah.
Yeah, because I'm not giving you the heavy duty. Because I'm trying not to kill you. Because if I kill you, it's not good for my malpractice.
It's like a vinegar.
Yeah, it's basically glycolic acid is just fermented sugar.
Oh.
They tell you, oh, Cleopatra used it. Okay, great. It worked well for her because she's still dead. Well, you know. I'm going to take pictures of the face thing and do that part again.
So just keep it like
basically,
warm water?
You can wash yourself with water and a mild soap, and then basically you're going to use these different little cream goodies to moisturize. The key will be your skin being real thin is going to be like hungry for moisture, like hungry. And so, well, drink water never hurts, but ultimately the key is keeping some kind of moisture, preferably water-based. I mean, I wouldn't use Aquaphor or any of the Vaseline-based things because you'll get acne from it.
Oh, okay.
Yeah, this one you just want to keep it moist. If you feel your skin and it feels kind of dry, you want to keep it moist.
Okay.
But and you don't have to slather it on, but you just want to feel like when you touch your skin with the back of your hand, that you just stepped out of the back of a shower.
Okay.
And really, the redness will go away within a day or so, and by the time Friday rolls around, you should be fine. I mean, and you're able to wear makeup after a couple of hours. You may get a little bit of flaking because your skin looks sensitive, but I wouldn't see you getting a full peel because that's why I don't even call these peels anymore. It's more like a chemical treatment. But it looks okay? She's like, no, I don't. Maybe a little okay. All right, bye, Allie.
Bye.
All right, here's Allie at a day. She's got a little bit of scabbing on some areas, but really for a light glycolic type treatment, she looks okay. You'll notice that the day after you do it, it actually makes some of the irregularities, some of the pigment on the face look a little bit worse. And she was just telling me that kind of in the shower things are stinging a little bit, but really it doesn't hurt. She just finds that she has to resist the temptation to pick at everything, because picking at stuff's probably not the greatest idea. If you don't pick at it, you're going to do better off. But nevertheless, this gets better, and then ultimately she could put makeup on now to camouflage, and it's only a day out. Alrighty then.